Hello and welcome back. We're talking about public health, public policy. And in this unit, we're going to really delve into the advocacy tools that play a critical role in formulating an initiative and taking an initiative to the next step. As you'll recall, what we've done to date is really looked at the policy making fora, who makes the policy makers, and we've also looked at the process by which policies and initiatives are formalized, and we've looked at how we take our initiative and market it and put a message onto it. Today we're going to be a little bit more technical in terms of the tools that we use for advocacy. So again, the frame that we're talking about is called a policy action plan. And within the policy action plan, as we've talked about already, we identify the fora, the venue in which our initiative makes the most sense to go forward in. For instance, does it make sense for this to be a local initiative, a state initiative, a federal initiative? That's one of the critical points of inquiry. We also have looked at who we would get to be sponsors. We went through the process to see how we get the policy paramours. So within the policy action plan, we have the policy process, policy paramours, policy entry point. And today what we're going to, we did messaging, marketing, and today we're going to focus on advocacy tools. So with that being said, where I like to start this discussion is really as policy professionals or as technical assistance providers for policy issues. What we are able to provide, what our commodity is when we sit down on the table, on an issue such as obesity prevention, which is, for instance, the issue I've been working on as an example throughout the modules. What we look at is what we bring to the table, and that is information. Information. That is our commodity. That's what we bring to the table. We're able to share information with others that they don't already have. We're able to do the research on the information that we need to move our initiative forward. So our commodity, I like to think of it, our commodity is information. And of course, we're blessed in this day and age because it's considered the information age. So when you think about trying to find information on various initiatives, it's really quite simple. There's quite a bit of information on each and every topic that you might want to be working on. So information is our commodity, and like other parts of the course that we've looked at, what I'd like to do is set out a framework by which we consider how we are dealing with our information. And what that leads to then is our advocacy tools. The framework in this case is as follows. Our step one is collecting and gathering information. And we do that in a number of ways. We do that through our data and evidence-driven research, through peer-reviewed journals and other types of scientific documentation. We also, so what I call hard research. And then we also have what I call soft research, which relates back to the policy process. The soft research being which policymakers would be interested in this topic, which stakeholders are going to have this as a priority, how do we get their support. So the hard research and the soft research are really the elements of collecting and gathering the information. Step 2 then is analyzing the information. What does this mean for our initiative? What does it mean, for instance, that Illinois has a form called the School Health Form that every parent must submit to the school prior to their child enrolling? What does that mean when we're analyzing that piece of information? What does that mean for our initiative? It means we might have a tool by which we can then add BMI to the form, as an example. So analyzing the information. Step 3 is assimilating the information. And that's what we're going to spend the remainder of our time on in this session, is assimilating the information. And of course, as in all the other modules, we will be looking for assignments and exercises to help develop these assimilation tools, or advocacy tools, if you will. And then finally, step 4, which we will discuss next module, is delivering the information. So we will come back to delivery. So what we're going to focus on today is how we assimilate. Step 1 is collecting and gathering, hard research and soft research. Step 2 is analyzing. Step 3 is assimilating, and step 4 is delivering. So when you think about assimilating a policy initiative into advocacy tools, there's several different tools that we look to. Advocacy tools. Assimilation. The first is what we call a fact sheet. A fact sheet. This is our currency in the policy world. And those that work with policymakers, those that work on policy initiatives, policy professionals, technicians, etc., all know that the commodity, that the currency is what we call fact sheets. And fact sheets are one-page assimilations of all of the research that you've done in that first step. So you collect and gather the information, you analyze the information, and then you assimilate all of that information into a one-page fact sheet. And on our virtual resource room, I will post some examples of fact sheets. And I will ask you also to look at your own fact sheets on your initiative. But I am very interested in kind of developing a template for the fact sheet that has the kind of message and market up top, the description of the initiative in a title, a description of the issue in 3 to 4 sentences, the rationale for the action-oriented approach in 3 to 4 sentences. And the proposed action in 1 to 2 sentences. And at the bottom, we have contact information. So I will give you examples of those in the virtual resource room. So our first advocacy tool is what we call a fact sheet. And it's very important that this is our tool that we put out there to the broader world, defining our initiative. I'm going to erase this. Our second assimilation tool or advocacy tool is press or media releases. So, and the beauty of these advocacy tools is they all build upon the same information. It's a matter of reformatting them for the technical piece that you're working. So for instance, with the fact sheet, that's our currency that we hand out to policymakers and stakeholders. In our press and media release, there's some very specific components that we look at. We look at a heading that is urgent, defines your issue in terms of urgency. Why is this important to be addressed right now? For instance, obesity epidemic in Chicago hits record high. Something like that. So the first thing that we have in a media release is a heading. We then have a description of the issue and the proposed action. And then we oftentimes in media and press releases see quotations from quotes from experts. So for instance, we might have executive director of clock says so and so. Okay? Now, it's a very strategic decision as to who you quote and how you leverage the quotes that you're making, how you use this as an opportunity to gain support for your initiative through the people that you might use in your press release. So for instance, you might use CDC there. Now, of course, you need to get permission from the individual at CDC you might be quoting before you put them into a press release. You have to get permission from the clock executive director before you put them in the press release. But it's a very specific and very strategic decision on who is the spokesperson, so to speak, on your issue. And then there's an ask. So contact your representative, or there will be a rally in Springfield, or there will be a rally in Daley Plaza, or this bill is up next week, contact your representative to support. So there's an ask. And then once again, at the bottom, there is contact information. Okay? So once again, in the resource room, I'll provide examples of press and media releases. We also have as our third advocacy tool, testimony. Now we will be developing testimony in a future module and discussing testimony in more detail later on. But as a brief introduction to testimony, this is very formal in terms of the presentation style on the issue. It's evidence and fact-based. It's a balance between factual and emotive. Factual and emotive. Very important balance. And it's short and to the point. And once again, we'll come back to this in a later module to discuss in more detail, so I'm going to leave it for right now. We also have other advocacy tools. I, for instance, like to have an advocacy tool that I call policy priorities. And so if you're thinking about obesity prevention, while I've been talking about the BMI initiative that we had, we have also worked on several other tangential issues as well. For instance, safe routes to schools, access to healthy foods, food in the school cafeteria, physical education in schools, recess. All of these come together, and we have to prioritize our policy initiatives. And so what I like to do with the policy priorities document is start with some quotes from key stakeholders on the front page. So we have quotes all the way down. And then what we do is we have a page that basically, 1 or 2 pages, that basically lays out, BMI surveillance, issue, proposed action. Okay, safe routes to school, issue, proposed action. PE, issue, proposed action, etc. So that's what I call a policy priorities document. There's also other things. We oftentimes see brochures, a trifold or a bifold that we can hand out to people. We have other tools such as websites, blogs, etc. And then we also have other types of ways in which we deliver this information, including letters and correspondence, and emails to policymakers. And again, the format of these letters, correspondence, and emails is strategic. So for instance, do we send it from our stakeholder group as a collective? Do we send it from an individual stakeholder? Do we use personal language? Do we use very formal language? Do we decide to use a letter, or do we decide to email? And some of this decision-making, strategic decision-making process comes back to our analysis of that soft research. Which policymakers look at their emails, for instance. How can we be effective at getting our point across? So we have lots of different tools, advocacy tools. We also have, going back to our messaging and marketing, we have all of those tools that we talked about in that module. The bumper stickers, the pins, the ribbons, all of these different things that we use as kind of attention getters. Attention getters. So all of these are ways in which we assimilate the information that we've collected and analyzed. And these are the tools that make up a policy action plan. I'm going to give you two more, and that's going to kind of finish us for the day. A lot of times we have a more substantive document called a policy brief. Now, the policy brief is a longer document that actually goes through a more technical and sophisticated analysis of our policy issue. And these documents are really designed to provide to the staff members of policymakers and the bureaucrats, the administrators, the regulators that we're dealing with on our issue, to give them more of a analysis of our topic. So a lot of times what happens in policy briefs is we look at a state by state, or what I should say, jurisdiction by jurisdiction analysis. For instance, who else is using school health forms to gather BMI? How is that working? A lot of states do it, and how can we help our policymakers understand how that's done? Oftentimes, these policy briefs have a cost-benefit analysis component. So how much is this going to cost, and where is the revenue going to come from? On the other hand, what are the cost savings? We know obesity costs tens, hundreds of billions of dollars on our healthcare system. So if we are able to put some prevention in place, what's the cost benefit? Now, I'm not saying that each and every one of you will be required in each and every case to do a sophisticated cost benefit analysis. But what I'm saying is, as part of our arsenal, as part of the tools in our toolkit, or the arrows in our quiver, we look to this policy brief as a potential. And finally, I like to put up the tool of a PowerPoint. And as an exercise, you will be preparing a PowerPoint that includes some of these components. And the PowerPoint is a nice tool because in a few slides you can assimilate the research that you've collected, both the hard and the soft. And people are used to seeing PowerPoints. They're comfortable with that format. So PowerPoints are a great tool to use. And I put that up there last because that leads right into the assignment and exercise section of this module. So with that, I just again want to emphasize that this is really the heart and soul of an effective and successful policy action plan, is to create advocacy tools that get your point across, that assimilate that information that you've gathered. Fact sheets, media releases, testimony, policy priorities, brochures, websites and blogs, correspondence, the attention getters, policy briefs, and PowerPoints. And of course, there are others, but that's the frame for what I wanted to share with you today. And we will be looking at then that last step in the process, which is delivering this information in our next session. So thank you very much.